Hey to dear community, I'm here at the campus of Boehringer Ingelheim in Vienna, and we're talking about the batch 4 of the Health Hub Vienna. 100 days it's already running, time really flies, and stay with me because this is really exciting because we already have some collaborations going on between the established companies and the startups which are in the Health Hub. And here with me Irene Fialka from the Health Hub Vienna, and Fredrik Wendschlag from UNIQA and Gerda Achzet from Boehringer Ingelheim. And just like to actually get a brief overview for those who are not aware of the Health Hub Vienna, Irene, what was the progress during the past 100 days of the batch 4?
Health Hub Vienna set out to change innovation in healthcare, to really drive healthcare in being driven by the change in healthcare. We work together with partners like Boehringer Ingelheim and foremost also UNIQA, who was our first core partner we developed the program with. In the last 100 days we're focusing on getting innovative international startups here to Austria, have their solutions really being watched, evaluated and tried out by the partners in order to get them to the patient, into the hospital, to the doctors, into the healthcare system, and to really accelerate the getting to the patient of the solutions.
Like overall evaluate the quality of the startups compared to like the previous batches and the beginnings of the Health Hub Vienna.
Well, Health Hub Vienna is looking for startups which have customer traction already in their respective countries. Usually they have investors traction, so most of them have more than 1 million, even much more of private funding, and they have a team size that can really deliver a project to, for instance, partners like UNIQA and Boehringer Ingelheim. That's the reason why it's a little bit later stage, is stage Series A or so, and this was really the first batch where we accomplished to get projects designed and started during those 100 days, and that's really speed. If everybody who works with collaboration between startups and corporates, that's amazing, and I think that was really due to the partners that are open and the startups that had that quality that the corporates really could bet on.
Speaking of the partners, Gerda and Fredrik, out of the perspective of UNIQA and Boehringer Ingelheim, how do you evaluate, like how are the startups in the Health Hub?
Okay, so then I start. So I appreciated the collaboration very much because first of all, during the Health Hub meetings, the cooperation, the interaction, the exchange was very fruitful. So we were able to learn from startups what are their unmet needs, where they need support, and we also learned about their requirements, and we also find this way of meeting in a way to really set up a pilot which makes sense in the short term at least, and then in the long term we will see. And I think also outside of the meetings themselves, because we had 5-6 meetings, Irene, during the batch, but also during this period we had a lot of interaction, and they were always willing to reach out to us and to talk to us. So it was a very fruitful time and collaboration.
So you have one collaboration already actually going on.
Yes.
Can you tell about like what does the startup do and what's the progress with that?
Of course. So we met one of the startups already in spring. It was a Danish startup which is working in behavioral change and gamification to improve medication adherence. So we were interested in that, but the cooperation really went in detail and was very much stronger than during the Health Hub Vienna batch 4 process.
The name of the startup?
The company is called Drugstars. From
okay.
Denmark, and we were interested in setting a pilot in the field of type 2 diabetes, which is a chronic disease, and patients take their medications but they easily drop out. So what is important to improve medication adherence, to reduce dropout rate, to have the patient more involved, being more adherent, and with this technology, there is a gamification process involved which gets patients motivated. They can get feedback, and on the other hand, they also get feedback from the app how they can be even motivated more. And we are happy that we have a pilot now in 3 countries in Europe, in type 2 diabetes and in respiratory disease. And we want even to bring it to a more European level to improve healthcare also for European patients. That's why we submitted this project to the EIT Health, which is the European Institute for Innovation and Technology. So we are eager to make it even bigger.
So what does happen when you submit it to the EIT Health? What are the next steps then after that?
Yeah, so there is a submission deadline in mid of December. So we already submitted our expression of interest together with Drugstars. And we are now in a phase where we need to bring the missing partners into the consortium. So we are still looking for a health insurance company in Europe and a health economic institution which could complete our consortium. And hopefully until March 2020 we will have our application final, and then we can kick it off from there.
Kick it off means like launch it.
So we will submit, and during 2020 the EIT Health will evaluate all European applications, and hopefully during the year 2020 we will get a final approval, hopefully in September, and then we could really kick off the project 1 year later.
Fredrik, you also have like actually several collaborations going on now as UNIQA.
The most diligent.
So like, let's go through them like one by one. Like.
Before that, I want to say something that is very important to me. I think the quality of startups has risen, and not only quality. I often work with startups that are kind of grateful if they work with some big corporation. I think it's the wrong way. Because I want to meet a company who is on like eyes length and arm's length, and I had the feeling dispatch. They knew what they want, and so the meetings were very efficient, very productive. It's not about what I can give them; it's more about what they can offer to me, and I can use it. And so we have, I think, 3 or 4 ideas this dispatch, and this is amazing. We have I would maybe cluster it in 2 groups. We have startups which will help us in we have like a partner network. We want to acquire doctors, pharmacies, and to give our customers a better service. And there's certain things like I want to do, for example, Doctify is a platform that tries to evaluate doctors, for example. And it's amazing for us to get feedback from our clients how to if this doctor is friendly, or how is the customer feeling with this. This is amazing for us. Another thing what we're doing is Match Share, or want to do is Match Share. It's about a communication platform between doctors. So that benefits 2 things. The first thing is interaction between doctors, so they learn it from each other. They get new stuff. They have new ways of thinking. And the second thing is it's a gimmick we can give to our doctors. If you want to get a larger doctor, for example, you have access to this certain app, which is amazing and leads to overall quality improvement of our society, of our partner network. And the second thing is, second group we have is about getting our customers or insurance holders healthier. We want to support them living a healthier life. And we will do that. We have it's called the Vital truck, or the Vital truck. It's a huge truck who goes around Austria and tries to make people healthy. It's like a fitness check in there, and there's like coaches who help you getting fitter. And they guys from Munich, they have a smaller version of that, but all digitalized. And this idea, we have that. I think we had that 15 years ago, but we have the infrastructure. But what we're missing is this digital part, and this is something I want to do next few months or weeks, I hope, to get the technology they have into our truck and to make this experience we have better and better and better. Yeah, I think that's a very short summary of the things we do. I think we have a lot of things to do in the next few weeks.
But how do these startups actually really integrate in your core business of UNIQA, which is insurance?
Yeah, I think it's a very good question, by the way. UNIQA don't see ourselves anymore as insurance. We see more like in German with a Gesundheitsdienstleister. We would like to bring benefits to our customers to live a healthier and longer life. We want to change into this kind of field, and so we have to take care of our customers. And this is with good quality doctors, with good preventive medicine, supporting a healthy lifestyle is something we want to do. And this is why we're here.
Irene, like we have two really great examples, but I think these are not the only ones, only collaborations coming out of Health Hub Vienna, right? Because there were also mentions of like that they collaborate with other pharma companies, some startups. So how's that going on now?
Yeah, we built a network, and we want to further grow that network. We're in the process of onboarding further partners. We started out with UNIQA. Pfizer, Boehringer really joined very early. There is also all the universities that are relevant in the healthcare system that are also part of the network, but also smaller companies like Victory or DWH Simulations, an amazing company, for instance, that does simulation of the Austrian healthcare system, which can help, also startups and big companies also to check out what if I change something, what could be the outcome. And we want to build an ecosystem not only with insurances and pharmaceutical companies, but with hospital chains, medtech companies, but also tech companies like telecommunication will be needed. If we talk about telemedicine, IT companies will be needed. If we talk about blockchain development, all different kinds of companies that have their stakes in the healthcare system, and in the end, it will. This discussion really covers 360 degrees, and will help everybody to take this other perspective. And also not only talk to startups and offer the startups this 360 degrees of know-how, but also learn from each other and really propel healthcare innovation and make it much faster.
So in other words, actually the journey of Health Hub Vienna has just begun, because there are much more partners that have to get on board to have a really great collaboration.
We are a startup too. Still, we're 2 years old.
You have some startup experience.
And there is a lot of vision in front of us and a lot to do. Yeah.
Cool. I thank you guys really for your time. This is really great, and I think we learned a lot about like new collaborations in the health tech sector of Austria. And dear community, thank you for watching.
Thank you for your partnership, and thanks for coming.